You did everything right. You ate well, exercised, you went to your screenings, but still you got breast cancer. And now there is that voice in your head. What did I do wrong? If you're watching this, I'm guessing you felt it too. That guilt, that shame, wondering if it was a glass of wine, the HRT patch, the stress at work. I've treated over 1,000 breast cancer patients, and I hear this from nearly every single one. And as a breast cancer surgeon, I need you to hear this. It's not your fault. If you've been diagnosed with breast cancer, there is a 99% chance that you've asked yourself this question at least once. What did I do wrong? And I need to tell you something important right now. This guilt you're carrying, it's not just in your head. It's actually biology playing tricks on your brain. In the next 15 minutes, I'm going to show you exactly why your brain is wired to blame yourself for breast cancer and what actually causes it. And most importantly, how to let go of that crushing guilt that's been weighing on you since your diagnosis. Because here is what nobody tells you. That guilt isn't just emotionally draining. It's making your recovery harder and longer. I'm Dr. Alex Popovich, breast and menopause specialist, and I've worked with hundreds of women who've been exactly where you are right now, constantly replaying every decision, every glass of wine, every skipped workout, every year you took HRT, thinking, if only I have done things differently. But what if I told you that the thing you're blaming yourself for had almost nothing to do why you got breast cancer? And what is the real reason you can't stop blaming yourself has nothing to do with logic and everything to do how your brain is hardwired to survive. Let's start with the most important question. What actually causes breast cancer? Here's the truth that nobody wants to hear because it's uncomfortable. Breast cancer is caused by mutations in your cell, a lot of them, and most of the time it's completely random. Think of your cells like a factory. Every single day, your body is making millions of new cells. And just like in any factory, sometimes mistakes happen. A screw gets put in the wrong place. A wire gets crossed. Most of the time, your body catches these mistakes and fixes them, but sometimes it just doesn't. And when enough mistakes pile up in the same cell, that cell becomes cancerous. There are three main things that increase your risk of these mutations happening. Number one, age. The older you get, the more times your cells have divided, and the more chances there are for mistakes to happen. It's like making photocopies of photocopies. Eventually, the image gets blurry. Number two, family history and genetics. Some people are born with cells that already have one or two mistakes in them. They're starting to race a few steps ahead. If you have a BRCA gene mutation, for example, you're starting with cells that are already more vulnerable to mutations. Number three, random chance. And this is the one that's hardest to accept. Sometimes there is no reason, no family history, no lifestyle factor, just the bad luck. And the vast majority of breast cancers happens because of these three things, the things you cannot control. And here is where it gets tricky, because there are things that can increase your risk, things that you might have done, and your brain knows this. So when you hear that alcohol increases breast cancer risk, or that obesity is a factor, or that you took a oral contraceptive pill or HRT for a long time, your brain immediately jumps. That's it. That's why I got cancer. That's my fault. But before you spiral into that guilt, you need to understand something critical about risk. Let me break this down for you, because this is where most of the guilt comes from. Things that you cannot control. Age. Every year you get older, your risk goes up. You can't stop aging. Being a female, simply having breasts puts you at the risk. Yes, men can get breast cancer, but it's rare. Family history and genetics. You didn't choose your family. You didn't choose your genes. When you got your first period and when your period stopped, starting your period early increases your risk slightly. When you've had your first baby, or if you had babies at all, if you've had a first child after age of 30, more so than even if you've never had children, your risk is slightly higher. And you can't go back in time and change that. Dense breasts make it harder to see cancer on mammogram. And it also slightly increases your risk. You don't get to choose your breast density. Now, let's talk about things that you can control. This is where the guilt lives. Alcohol. Yes, alcohol does increase breast cancer risk, even in small amounts. But here is what they don't tell you. The increase is small. We're talking about going from 12% lifetime risk to maybe 13% if you drink regularly over 14 units per week. Exercise. Regular exercise does reduce your breast cancer risk by approximately 20%. But again, we're talking about small percentages. We're talking about 2 to 3%. Obesity. Being overweight, especially after menopause, does increase the risk, but it's not the main driver. Ultra-processed foods. There is emerging evidence that highly processed foods may increase the risk, but the research is still quite new. And that there is a big one that so many of my patients blame themselves for, HRT. And let me be very clear about this, because this is where the guilt is the strongest. If you've been taking HRT and you develop breast cancer, I know exactly what you're thinking right now. I did this to myself. I caused my own breast cancer. But that's not how it works. And understanding why will change everything. Here is an analogy I use with all my patients. Think of you as your garden. If you water your garden, the plants grow, right? But water doesn't create the seeds. The seeds were already there. HRT is like water. If you have cancer cells already growing in your breast, estrogen may help them grow a little bit faster. But estrogen didn't create those cancer cells. The cancer was already there. You didn't cause cancer by taking HRT. Now, I know what you're thinking. But Alex, if HRT made it grow faster, isn't that still my fault for taking it? Now, this is what we know from research. If you develop breast cancer while on HRT, your prognosis is actually the same as someone who wasn't on HRT. The cancer isn't more aggressive. The cancer isn't deadlier. It was just detected at a time when you happen to be on HRT. And here is another thing. If you haven't taken HRT, you might have suffered through years of debilitating menopause symptoms. Hot flushes, insomnia, brain fog, bone loss, heart disease risk. You made a decision based on the information you had at the time to improve your quality of life. And that's not something to feel guilty about. So if you've been carrying this guilt, I need you to hear this. You did not cause breast cancer by taking HRT. But I know that even hearing all of this, some of you are still feeling guilty. And there is a reason for that. Because guilt isn't logical. Guilt is biological. And your brain is doing something right now that's actually designed to protect you. but it's backfiring in the worst possible way. Let me explain. When something bad happens to us, our brains immediately start searching for reason. Why did this happen? What caused it? And here is the trick. Our brains would rather blame ourselves than accepting that something was random. Why? Because if it's random, that means it could happen again, and we have no control over it. And that's terrifying. But if it's something we did, then we can fix it. We can control it. We can make sure it never happens again. So your brain looks for patterns. I drank 3 times a week. This must be why. I took HRT for 5 years. This must be why. I didn't exercise enough. That must be why. Your brain is trying to protect you by giving you a sense of control, but instead it's making you feel guilty. And here is the other thing. We live in a culture that loves to blame people for their own illnesses. If you just ate better, you wouldn't have gotten sick. If you exercise more, you'd be fine. If you avoid toxins, this wouldn't have happened. It's everywhere, and it's toxic. Because it puts the burden of illness on individual when the reality is that most diseases are caused by complex mix of genetics, environment, and random chance. But that's not a satisfying answer, so we blame ourselves. Now you might be thinking, okay, but Alex, what about the things I can control? Doesn't that mean I should have done better? And this is where we need to talk about something really important. Look at the actual numbers. Your baseline risk of developing breast cancer in your lifetime is 12%. That's 1 in 8 women. And let's say you drink alcohol regularly in high quantities. That might increase your risk to, let's say, 13%. It's an increase, yes, but it's small. And let's say you're overweight. That might add another 2%. And let's say you took HRT for 5 years. That might add another 0.5%. So even if you did all these things, you're looking maybe at 15 to 16% lifetime risk. Still not guaranteed. Still mostly random. Compare that to your age and genetics, which are responsible for vast majority of your risk. If you have BRCA1 mutation, your lifetime risk might be between 50 and 70%. That's genetics, nothing you did. If you're over 70, your risk is significantly higher than if you are 30. 10 versus 0.5%. That's age. Nothing you did. So yes, lifestyle factors matter, but they're not the main story. Even if you did everything right, you could still get breast cancer. But here is one more piece to this puzzle that I think is really important. And it is about how much we actually knew about breast cancer risk when you were making those decisions. 20 years ago, we thought HRT caused breast cancer, so we told women to stop taking it immediately. Now we know that's not quite right. HRT doesn't cause breast cancer. It may accelerate growth of existing cancer, but it doesn't create it. 10 years ago, we thought all fat was bad. Now we know that's not true either. 5 years ago, we didn't know as much about ultra-processed foods as we do now. The point is, you made the decision based on information you had at the time. You can't blame yourself for not knowing something that science hasn't figured out yet. But even now, with everything we know, we still cannot predict who will get breast cancer and who won't. You didn't know. Nobody knew. And even if you had known and you did everything right, stopped HRT, stopped alcohol, lost weight, eaten better, it might not have changed anything. And that's a hard thing to understand and accept. So now that you understand why you got breast cancer and why your brain is wired to blame yourself, let's talk about what actually matters now. Because guilt doesn't help you heal, but these things do. Most important thing you can do right now is focus on your treatment. Work with your surgical team, understand your options, ask questions. Whether you're having a lumpectomy or mastectomy, whether you need chemotherapy or radiation, whether you're going on hormone therapy like tamoxifen or letrozole, these are the decisions that matter right now. Not what you did 5 years ago, not that glass of wine that you had last week. Your energy needs to go into making informed decisions about your treatment and your recovery. And if you're struggling with treatment decisions, I have other videos that break down all these options in detail, and I'll link them in the description. But beyond treatment, there are things you can do right now to support your body and your recovery. And some of them might surprise you. Your body is going through a war right now. It needs rest. Don't push yourself. Listen to your body. Eat whole foods, lots of vegetables, protein, healthy fats, because your body needs fuel to heal. Gentle movement is good. Walking, stretching, physiotherapy exercises to prevent shoulder problems after surgery. But don't overdo it. I'm not going to tell you to never have a glass of wine again. But if you are in active treatment and recovery, it's worth minimizing alcohol because it can interfere with treatment and healing. These things won't undo your diagnosis, but they will help you feel better and recover faster. But there is one more thing that I need to talk to you about, and it's the hardest one. Cancer happened to you. You didn't invite it. You didn't cause it. It just happened. And carrying guilt isn't going to change your diagnosis. It's going to make your recovery harder and longer. So let it go. You deserve to heal without the weight of guilt on your shoulders. You deserve to focus better, not on punishing yourself for something you didn't do. And if you need help with this, talk to a therapist, talk to a support group, talk to other women who've been through this. There's many of them. Because you are not alone. And you are not to blame. But understanding that breast cancer isn't your fault is the first step. The next step, making the right surgical decision for your body. Because whether you choose lumpectomy or mastectomy, you need to know the right questions to ask your surgeon so you can feel confident and empowered in your choice. So check out this video where I break down the 5 critical questions you should be asking before your breast surgery that will help you take control of your treatment journey.